The whole human body has, everything is important. Important in the sense of functional. Naturally, the thorax. Now you have the heart, the lung, and other structures which build up the thorax. There are some bony structures, there are some your muscles, fascia, pleura, soft tissue lung, and the heart itself, which is a muscular, this thing that is pumping blood from the day it is born, means not born in the, it has come into existence. We are reading embryology, that is a tube, the heart, and then it comes into chambers, and then intervertebral septum, then the joint, the valves are developed, all this. In the embryo, you can see it. That's why when you do an USG, in the first trimester, means by, I would rather recommend by 12 weeks, then you will see the heart pulsation. If there is a any suddenly a lady comes with miscarriage or spotting, then you go for an ultrasound, because you have to see, the first day your urine is positive, you are people are now Prega News, the title itself, that the people they do it in self, USG is self. Then the urine test, that is done by the woman itself. Okay. Now, with that, she comes with you to abort it. One group is that they want an abortion. One group is the first child, they want to keep the child. And if there in between this, there is a slightest bleeding or your spotting, then you have to take care. You have to take medicine. Then you go for an USG. Then you will get a USG report with blighted ovum. Now, why I'm just discussed this to you? Because see, the blighted ovum, this gestational sac is just has been formed, but typical embryo is not formed. The complete embryo is not formed, and these stages, according to the weeks, it happens. So, what happens? The sonologist, they say that it's a blighted ovum. Rescan after 3 weeks. So, if there is a chance, but in my personal experience for the last 40 years, that time when I didn't have an USG, I would minus that. But now, if say recent years, I would say 25 years. Okay. Now, if the USG showed a blighted ovum, I think there are no chances of some rejuvenation or some drugs or something that will again that will be it becomes normal. It doesn't come. Okay. Now, this I would say this is your main study. You have to, because the thoracic cage is one thing important now in this road traffic RTA, road traffic accident. People are riding bike and cars in high speed, and suddenly they go. I told you last time when I just gave you a glimpse of the windows to the nervous system. In that, I showed you the slides that different types of injuries can happen to the thoracic cavity. Now, if there is you go for this thing that you see, you feel, and if there is a fracture rib, it makes a put, which like this sound. It is like you have, now if there is injury here, then there might be, if there is no hole or some direct, then it goes into pneumothorax, hemothorax, blood contusion injury or some direct injury, then there will be blood in the thoracic cavity, and the patient is gasping, and that you have to give an oxygen. Okay, if it is a minor thing, you can do in your, see, you are in your Muluk, some polyclinic. Suddenly one person comes, this thing for an emergency, then you have to diagnose and say, try directly go to the hospital. Okay. Now, what I would rather say that this the thoracic cavity, if it is a minor injury, after an X-ray, if you find a minor injury, then you do some strapping, oxygen, analgesic medicine. Now, whatever it is, this is covered by the skin, then the muscles, and the you will see in your the thing that dissection, that the vessels are there, nerves are there, intercostal vessels and nerves. Okay. Now, it is a this you know that you can the sternum, typical rib, atypical rib, thoracic vertebra. Now, this is the thoracic vertebra and this is thoracic vertebra. Now, the ribs are articulating with the thoracic vertebra, transversus. With this is any joint has, I told you that day, that ligaments, capsule and all this comes into that. Now, what's happened? The evolution of erect posture, we were quadruped, we were like this, like a gorilla, and the gorilla had big hands and knocked. You see in your these channels, so they move like this. Now slowly from that we have become erect. Now with this the total thing has changed. The skeletal elements, this thing of the human being is bit different. Not bit, so different, but it is, if you go to the comparative anatomy of any animal with this thing, it will be the vertebra, mutton, you go to the mutton shop or meat shop, whatever it is, you see they are cutting the rib cage. You tell, hey, either de do, cut. You want to this thing. Now the muscles are there, the skin is there, muscle is there, then the pleura and intercostal muscles. So intercostal muscles. Now these are the ribs. Now identify and describe features of first, second, third, 11th and 12th ribs. And first, 11th and 12th rib thoracic vertebra. First, 11th and 12th thoracic vertebra includes sternum and ribs. Now this is the sternum. Okay, you have already read the sternoclavicular joint. Okay, now this is the thing. Now, now you see the thoracic cage consists of sternum. This is sternum. 12 pairs of ribs, 12 thoracic vertebra. Thoracic cage protects heart and lungs and helps in movements of respiration, that I told you. Now, even if you have any severe pneumonia or lower pneumonia, or there is some fluid collection due to some pathological condition, it might be tuberculosis, it might be some acute pneumonia leading to your fluid collection in the pleural cavity. Now, the median bone lies anteriorly to the chest wall, anteriorly to the chest wall. And there is a big bone in the posterior aspect, this is sacrum. Now, this is the sacrum. I'm sorry to say that in the previous 4 batches, some persons, when you tell them, please lift up the sternum, they are catching the sacrum. That happens. It can happen. It has happened. So you have to remember that this sternum is a small piece of bone which has 2 fragments. One is your Manubrium sternum. But the sacral part of this sacrum is sacrum. See, you cannot make a mistake in such a thing. See, this is the Manubrium sternum. Now, in the sacrum and the thoracic and the lumbar vertebra, sacroiliac joint, the ilium of the hip bone, it forms a joint here, sacroiliac joint, this part. And these are the lumbar vertebra. The fifth lumbar vertebra articulate to the first sacral vertebra. Now, why I am telling you that I have encountered few of your dadas and didis. They were so nervous or could not correlate. So, Manubrium, don't make a mistake of Manubrium, of the whole anatomy and the structure of the Manubrium itself speaks for itself. Yet this is Manubrium, this is sacrum. Okay. Now, see, this is the thoracic cage. Here, from the thoracic vertebra, it comes and articulates with. Now, it has to have these facets. These facets here. See, first sternal angle, this is the second, third, fourth, fifth, sixth, seventh. Now, the elongated flat bone, convex anteriorly and concave posteriorly. Now, see, this is convex anteriorly, this, and this is the concave part. If you see, when you come individually, you can see the thing. And hey, Avinash. Anyway, I will tell this thing. Now, length is. Now, sternum articulates with both the clavicles at the sternoclavicular joint, upper 7 pairs of costal cartilage at the sternochondral joint. কোনটা এখন এটা ভিজুয়ালাইজ করে নে, তারপরে ওখানে দুটো গ্রুপে ভাগ হয়ে যাবি, তারপর নাহলে ওই করবি এ চুল কাটবে, ডোন্ট। হ্যাঁ, আমি খালি তুই ইউ হ্যাভ দি কনসেপ্ট, বই ফেলবি dissector or this thing, and amongst you discuss. Now, upper 7 pairs of costal cartilage are sternochondral joint. Contains highly vascular trabecular bone from hemopoietic function even in adults also. So, you want to do any severe anemia, you want to study the bone marrow, then you go for a sternal puncture or a baby. Now, that you do it in this, or you can do it in the iliac crest, but it is easily accessible. Now, sternum, hold the sternum in such a way that rough convex surface faces anteriorly, broad Manubrium lies superiorly and pointed xiphoid process lies, this is xiphoid process, inferiorly. Anterior surface of the sternum is slightly inclined forwards. You will see the sternal angle like this. The manubrium is like this. You can see it. You can see it over here. You can see it there. Okay. Now, features of the sternum. Three parts: manubrium, sternum, body, and xiphoid process. This is the body. Okay, and this is the xiphoid process. See, three parts. 1, 2, 3. Okay. Now, it is quadrilateral in shape, broader above and narrow below. See, this is broader above, narrow below. Has two surfaces, anterior and posterior. Has 4 borders, superior, inferior, and 2 lateral borders. Superior, inferior, and 2 lateral borders. Now, these are the muscles, the surfaces and borders. The superior forms suprasternal jugular notch, clavicular notch, and lateral borders, upper facet, first costal cartilage, and lower demifacet, second costal cartilage, and the inferior border, manubrium joint. I'll just go back to the picture. Here, this first, this is the clavicular notch. Okay, this is the clavicular notch, and this is the first rib. First rib articulates there. Get it? Now, this forms the sternal angle. This is the second rib, third rib, fourth rib, fifth rib, sixth rib, seventh rib. Now, see, the anterior surface is smooth. This is smooth. This anterior surface is smooth over here. And pectoralis major, sternal head of sternocleidomastoid. These are attachment of the anterior surface. Posterior forms the anterior wall of the mediastinum. When you read thorax, there will be anterior, superior, middle, mediastinum. Okay, and the posterior and the sternohyoid muscle and sternothyroid muscle. Sternum to the hyoid cartilage, that is sternohyoid, and sternothyroid, thyroid cartilage, you got it. This is Manubrium sternum. Now you can see the smooth convex side to side gently concave from up attachment. On each side, origin of pectoralis major and sternal head of sternocleidomastoid. The sternal head and the mastoid process. It is attached here and it is attached here. Over here. You just turn like this. Okay. Now, posterior surface, you will be coming when you read in detail, okay, and these muscles are attached on the this sternothyroid, sternohyoid in lower part, upper notch near clavicle, forms anterior boundary with the superior mediastinum, related to arch of the aorta, brachiocephalic artery, left common carotid artery, and left subclavian artery, left brachiocephalic vein, lungs, and pleura. This is a very important question in Viva. It can be a 10 marks question or 4 marks question. This is important. Even MCQ come. Okay. Now, all these components, the aorta, brachiocephalic artery, left common carotid artery, that doesn't come as an MCQ. But out of that one, the pattern, you know. Now the inferior border. Now this is the body. Now see the anterior surface, there are three ridges. Pectoral is major, sternum costalis from lower part. Now borders, two lateral borders, articulate with the second to the seventh costal cartilages. Second to the seventh costal cartilages. These are all costal cartilages. Okay. Now you see the intercostal membrane, internal intercostal muscle. Ends, upper end mandibular joint, secondary cartilaginous joint, lower end xiphoid joint, cartilaginous joint, primary cartilaginous joint. Now, upper end articulates with the manubrium and forms the mandibular joints, and lower end narrow articulates with the xiphoid process and forms xiphoid joints. Now, ends of the typical rib. Anterior end cup-shaped and depression with costochondral joint. Now, you can see this is the costochondral joint is here. So, it has to be like a socket. This is a packet of left ribs. Okay. I'll put it in two trays. Few of people go there and see this thing, and another batch you sit here and see. Okay, and I'll tell you. Now this is the mala for Tantra sadhana. Jago. So you see 7 cervical vertebra count and 12 thoracic and the lumbar vertebra. Vertebral bodies will be teaching you later on, but pertaining to thorax, you get acquainted with the not only the ribs, but the ribs where they get articulated with. Okay, anteriorly, it is this is the sternal joints over here. Yeah. Now you see, please don't drop and break, and please keep it. That's just 400 years or 4,000 years it will last. It will be in the museum. So anyway, you will be now see the ends of the typical ribs. It is cold. Packet of actor. Now see ends of the typical ribs, anterior end cup-shaped depression, costochondral junction. It's a cup-shaped, I'll show you just now, it's a cup-shaped this thing that is going into the socket. And the other end, the head, neck, and your shaft, it is like this. And that is getting, and there's a small socket like hole. Okay. These are artificial bones, okay, but this is a socket. You can see over here. The socket is there. Actor niya to typical bone niya. Now that articulates there, and posteriorly it articulates with your Now, this is thoracic vertebra. Now, the articulate two surfaces, like the upper upper vertebra will be articulating with the upper articular surface of the rib and the lower. Then that is in the transverse process of the vertebra, that is having ligaments getting attached. Okay. This is the chondral end. Yes. Yeah. It articulates here. And the posterior part is getting articulated here. You have to see the side determination. Oh. Now this group, intercostal group, that is the rib space. Space when intercostal muscles are there and vessels are going on. That's why anything that either it breaks the rib with an injury, or the muscle it penetrates, or if there's a fracture, then breaks in the thing. But that doesn't get, of course, the extensive trauma, it gets the thing broken and it penetrates the lung even. Then there is, if there is a contusion injury, just like that, or a blow, then according to the severity of the injury, if the blood trickles down and collects here and knows that hemothorax. And if there is a patient comes with any disease condition, pneumonia, tuberculosis, and there's pleurisy, there's dullness over here, and there is some crepitation sounds between the pleural and surface and the lung blows, then you get a sound is there. That is, if there is any obstructive disorder, or then there will be rhonchi with the slippery Okay, these are some minimum pathological condition which we discussed here. I discussed with you. Now you see the ends of the bones, the groove, and your maximum. The seventh. This is the first. Okay. First, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th. And there are two floating ribs. Floating ribs. Okay. Now you see the this is the human bone. Human bone means not artificial, it's true bone. See, you can see the yellowish, that is the cartilage. This is the cartilage. This is the 12th rib, floating. Okay. Now, so you are getting karate training. See, this I told you earlier, the site of hematopoiesis. Sternum contains red bone marrow throughout life. The marrow, bone marrow throughout life. So, sternal puncture performed to obtain red bone marrow sample for hematological examination. This procedure, thick needle is inserted in the upper part of the manubrium to avoid injury to the arch of the aorta. Should it be avoided in children as sternum very thin and in them. Now, the funnel chest or cobbler chest or sunken chest that you will encounter in your clinics. Okay. This deformity most common congenital anterior chest wall 500 live births. This deformity lower end of stomach and lower ribs pushed backwards, decrease in anterior posterior diameter. This you did not this thing, but you have to identify rib and you hold it in the anatomical position that you place it. See, it will be like this, flat. But if you put it like this, see, this is going like this. This is a like this. This is left, but if you put it here like this, then the anterior end is the articulars of two articular sockets with the it articulates with the above vertebra and the lower corresponding the upper part of socket. Upper part, lower part. The second thoracic, it articulates and the lower socket, it articulates with the upper articular surface of the thoracic vertebra. Bujhe gelo? Understood? But this is articulating with see this bone, this articulating this transverse process of this process, and this is the upper is this thing articulating with the transverse process of the মানে দুটো ইয়ের মধ্যে বোর্ডটা নেই, এটা খুলতে এটা তুলে দে, না না স্ক্রিনটা তুলে দে, পেন আছে পেন নেই, পেন. These are the two vertebrae. Okay. Now the rib comes in between. The upper articular surface of the rib articulates with the lower and the lower articulates with the lower this thing. Upper of this rib, you see. Now these are all muscles, ligaments are there. Now this articulates with this bone and the lower part articulates here. Okay. Now ribs, also called costae, equal rib in Latin. Flat, elongated and curved bones, costal arch, rib and its corresponding costal cartilages form costal arch. Number, there are 12 pairs of ribs, arranged one below the other, one below the other, one below the other. Now, this one below the other. Okay. Now, intercostal space, the gap between adjacent ribs, the intercostal space gap between adjacent ribs is called intercostal space, oblique arrangement, placed obliquely. You can see it is placed like this, obliquely. If you feel like this, but you have a pot belly, so that can be a bit misleading. But you see in the skeleton, আর পেন এই কাউরের পেন ফেলে এসছো কোথাও, ঠিক আছে রেখে দিই. Now, আমি বলছি যে কনসেপ্টটা তোমার যদি তৈরি হয়ে যায় না, তখন তুমি নিজে থেকেই সব দেখে নিতে পারবে। এক্ষুনি আমি ইয়ে করে দিচ্ছি, তোমরা সার্ভাইকাল ভার্টিব্রা নিয়ে ভাববে না এখন, অনলি 12টা thoracic দেখে নেবে one by one. Don't be in a hurry. So you see, I've marked the 7 vertebrae are there. Now this is first thoracic, second thoracic, third thoracic. This is third thoracic. Now you just have to see it, and gap between adjacent ribs are intercostal space, oblique arrangement placed obliquely. You can see the oblique arrangement of the chest. Now, lower ribs more obliquely arranged than upper ones. Ninth rib is the most obliquely arranged, and below it obliquity gradually decreases. Now, the ninth rib. Now, this is the ninth rib. The obliquity decreases below, as you see. But over here, you see, it is like this. Okay. Now, length increases from the first to the 7th rib and then gradually decreases. Now, first rib, second rib, third rib, fourth rib, sixth rib, 7th rib. This is the 7th rib. Now, 7th rib, the obliquity, this, and in the 7th rib, it is the longest rib. It is the longest rib. Anterior ends of ribs attached to the sternum through costal cartilages, except that of the 11th and 12th. That the 11th and 12th, I told you, this is floating ribs. Okay. Now, according to articulation with the sternum. Now, according to articulation with the sternum, classified as true ribs or vertebro-sternal ribs. Now, what is true ribs? It is the true ribs or vertebro-sternal ribs. Articulation with the sternum. Now, true ribs or vertebro-sternal ribs. Their anterior ends articulate directly with the sternum through costal cartilages. I have showed you an example. This is 1 to 7 pairs of ribs. There are how many pairs of ribs? 12. So 7th rib হয়ে গেল. The false ribs, their anterior ends do not directly articulate with the sternum. Example 8, 12 pairs of ribs. So 8, 12 pair of ribs, it is the costochondral junction. That's the costochondral junction. But it is not directly articulating with the sternum. Now, classification, they are of two types: vertebrochondral ribs, costal cartilage joined with the costal cartilage, the next higher costal cartilage. You see, this is the costal cartilage. It is here, yeah. This is the costal cartilage. This is articulating with this costal cartilage. The above, the below one gets articulated with the costal cartilage. This is the again. It is getting. This is no bone. This is no bone. It is being connected. Okay. Now, example 8th, 9th, and 10th pairs of ribs. Now, 11th and 12th is your this thing. 7th rib is most this thing. It is angulated and it is like this. And in the 11th and 12th pairs of ribs, according to morphological features, typical ribs, 3rd to 9th pairs of ribs have same general features. So you read one, you will get the same general features. Now, atypical ribs are 1st, 2nd, 10th, and 12th. Typical, atypical, 1st and 2nd, Atypical ribs first, second and 10th, 12th. These are small. First rib you see in the skeleton plus over there. First rib, second rib, okay, and 10th and 12th. So at a borrow a big rib. This is the groove, the costal groove below. Its costal groove is facing below. And see, it is like this. Now, this is the typical rib. Now, this is the atypical. This is the first rib. This size does not match with that size. Everything. Amongst you, if we open the skeleton, imagine your skeleton is being dissected out. You are living. Okay. And you will see, you will tell, no, yeah, this is atypical. Okay, this is the typical. Get it? Now, this is the thing. Now, the typical ribs are 3rd to 9th, 1st, 2nd, 10th, 12th, bang in your head. Now, the first, 2nd and 10th, 12th ribs atypical, typical ribs are 3rd to 9th. So, different features then remaining. Now, see the ribs, true ribs. Vertebro-sternal ribs, 1st to 7th rib, vertebro-sternal, sternum and your vertebra. Okay. Now, ribs, typical 3rd to 9th ribs, atypical 1st, 2nd, 11th, 10th, 11th, 12th ribs. Floating ribs, vertebral ribs, 11th and 12th ribs. Vertebrochondral ribs, 8th, 9th, 10th ribs. বোঝা গেল? ছবি তুলে নাও। একজন একজনকে দিয়ে দেবে। ঠিক আছে? Now you see I told you earlier that there is a depression in the concave depression. ঠিক আছে? This. You see the sharp border that would be below. Now, have common general features. See, hold the rib in such a way that anterior end has concave depression and posterior end has a globular head. This is the globular head. This is the globular head. Okay. Now, you will see globular head. Now, shaft, flat and convex outwards, outside. Convex. ঠিক আছে? Now, the costal groove, shaft flat and convex outwards, and your costal groove sharp inferior border lies downwards, convexity of shaft directed towards side of rib, tilt rib, so posterior end lies at a higher level and anterior level. And when you hold it like this, you think of your own this thing. So you hold it like this, not like this, not like this. You hold it like this. Okay? See, this is the head. See, the superior facet, this is the crest of the head, inferior facet. Now, the superior articulates with the upper vertebra and this is the inferior vertebra. One rib articulates with one your two vertebrae. Now, this is the articular part, the tubercle, non-articular part, costal ridge and external surface, internal surface, the anterior end. And see, this is the hemopoietic tissue, the red bone marrow, superior rounded border and inferior sharp border. I told you the inferior sharp border. See, this is the group there. And this is the inferior border, like this.